I mean, you think, is that a change that we should make?
Yeah, I think actually we would. We'd really focus on it. You'd have more, as we say, skin in the game.
Because
people would, and especially if they had a savings account, a health savings account, they could put their money into that, and they'd be spending the money out of that.
Would you feel the same way if you were making $40,000, or you had that was your income? Because that's the reality for a lot of folks. I mean, it is very important for us when you say to listen to that farmer that Tom mentioned in Iowa, to listen to the folks that we get letters from. Because the truth of the matter, John, is they're not premiers of any place. They're not sultans from wherever. They don't fly in to Mayo and suddenly, decide they're going to the absolute best health care. They're folks who are left out. And this notion somehow that the system was working, and that if the vast majority of these 27 million people or 30 million people that we're talking about, they work every day. Some of them work 2 jobs. But if they're working for a small business, they can't get health care. If they are self-employed, they can't get health care. And you know what? It is a scary proposition for them. And so we can debate whether or not we can afford to help them, but we shouldn't pretend somehow that they don't need help. I get too many letters saying they need help. And so I want to go to...
Mr. President, having a high deductible plan and a health savings account is an option for members of Congress and federal employees.
That's right, because members of Congress get paid $176,000 a year.
Did take advantage of that.
Because
because members of Congress that the park rangers get in the Yellowstone National Park.
John, members of Congress are in the top income brackets of the country. And health savings accounts, I think, can be a useful tool, but every study has shown that the people who use them are folks who've got a lot of disposable income. And the people that we're talking about don't. So I'm going to go to Henry. Henry Waxman.
Mr. President, I just wonder if some of our Republican friends would like to have seniors on Medicare have catastrophic coverage only. I'd say to the seniors in this country, and we've heard mention of them being the people who are worried about this Medicare, this health care bill, they ought to worry if we don't do something. Because not only will we hear ideas of putting them on catastrophic coverage only, because that'll save a lot of money, Paul Ryan has a proposal right now to say that Medicare recipients in the future ought to have just a little voucher, and then they can shop for their own insurance. They could be prudent shoppers. Well, yesterday I had a hearing with some people who were supposed to be prudent shoppers. There are people from California who were told by Anthem WellPoint that their insurance was going to go up 39%. And could you imagine, seniors, if you have to go shopping with your voucher and then you're told, oh, by the way, this private policy that you're going to have to buy just went up 39%? And the way to save the federal government money is to shift it on to the seniors. That's where we're going if we don't do anything. Now, what do we do that makes sense? We've got to hold down health care costs. You can't, we had some ideas that we seem to agree about to hold down health care costs. One idea I did find peculiar, and that's to have the medical malpractice issue at the federal level. And the Republican proposal is to adopt the California law. Well, the California law is in effect. It's been in effect since the 1970s. And Californians are faced with a 39% increase, so it isn't holding down their health care costs. We've got to really look at holding down health care costs. That's hard to do unless we have insurance reform so we can get more people buying health care. I thought Tom Harkin just summed it up so well. All these issues go together. If you don't bring more people in to be covered, and you segment the groups that are covered in high-risk pools, they pay more money. Everybody else is going to get a break. Well, under the Republican proposal, the people who get a break for insurance are the people who are healthy. The people who have to pay more are the people who are sick. Is that what we want in this country? Now, I hear people all day say, Mr. President, the public doesn't want your plan. Well, if I heard the kind of rhetoric over and over again that I've heard from some of the Republicans, I wouldn't want your plan either. A federal takeover of health care? That's not what's being proposed. Somebody said that, people ought to be able to buy a policy that suits their needs. Well, how many people are going to come forward and say, I don't want certain things covered, and then find out that they're sick and they need that coverage? We need to have a market like the federal government employees, like members of Congress. We know what we can choose. If somebody wants to choose a health savings account, that means because they want to put some of their money away because it's tax-free and it's just a really great deal if you got a lot of money. But most people want to know they're going to have necessary medical coverage for the doctors and the hospitals when they need it. And you have something that's basic to everybody. Well, they ought to have that for people who are buying private insurance as well. We had 3 witnesses yesterday. A woman told us that in her family she had a child with a hole in his heart, and that because that became a pre-existing condition. So she has health insurance coverage to this individual market. But she says, I barely use it because I'm afraid to use my health insurance. She's now told she's going to have this 39% increase. She said her health insurance is going to cost her about as much as her mortgage payment each month. She's afraid to drop it because she doesn't know where she could ever get health coverage again. Another woman had asthma, and that was considered a pre-existing condition. She was going to face a 39% increase as well. Now, if they were pooled with everybody else in that small business and individual market, which is what our bill does, then there are more people buying insurance and there's more leverage. It's spreading the costs, not making people have to pay more of these costs. The people who we're talking about are people in small businesses where the small business can't get insurance because, well, they got one employee with a real serious medical problem, so nobody in that group's going to get coverage. The employer can't afford it. Or women cost more for small businesses if they're in that workforce, especially if they're older. They don't want to get coverage. They don't want to give them coverage either. We have single adults, a lot of them not very healthy, dealing with chronic conditions, parents and families living on low incomes. They need help from Medicaid. We have to hold down the cost by bringing everybody into the system. Now, in Medicare, what does our bill do? It protects the solvency of the program for an additional 7 to 9 years. For Medicare, we close the donut hole, which means that when seniors have to pay for those prescription drugs, they don't have to do it all on their own. We keep them with a Medicare policy, and we provide preventive services, and they don't have to pay for them because we know preventive services will keep us from having to pay for more costly care. This bill is good for people on Medicare, and if we don't get this bill passed, they're going to get squeezed like crazy. This bill is good for the American working people. This bill is good for our health care system. And for us to take the Republican proposal, we'd cover, instead of 30 million people, 3 million. We wouldn't hold down the deficit a bit. We would still have all those pre-existing conditions that would keep people from getting their insurance coverage. Maybe if people go and pretend to be patients, we could stop some of those false claims. But I'm sure those false claims happen in the private insurance market, not just the public insurance market. But not only are we covering more people, we're doing innovative ways to deliver the care that will make it less costly. And as we develop innovative ways to deliver care, especially with chronic care, that will hold down the costs of care, and those ideas will be picked up by the private sector. They always follow what Medicare does, and then they adopt it because they want to hold down costs. So you can't solve any problem. Insurance reform, holding down costs, protecting Medicare, dealing with the deficit, unless you deal with it all. And Mr. President, you're not going to be able to do this piecemeal, And I have doubts about whether the Republicans are going to help you, because I haven't heard a lot of willingness to come and work with you now, or did I hear it a year ago?
Well,
I hope I'm wrong.
I'm going to be equal opportunity here and say, we're not making campaign speeches right now. And I think your points I agree with, but I still think that there's a lot of areas of agreement that we've discussed so far. This is an area, though, that in which we do have some philosophical disagreements.
Mr. President.
And so what I think I want to go to a Republican. The question I would ask to my colleagues, my friends on the Republican side, would be, are there areas of coverage for people who don't have health care that you would embrace and agree with beyond what has been presented in Republican leader Boehner's bill? There may not be. I mean, that may be sort of the threshold at which all of you think we can afford to provide help to people who don't have coverage, but there may be some other ideas that haven't already been presented or aren't embodied in your legislation, John, that I'd be happy to hear about.
I want to yield to Peter Roskin from Illinois.
Thank you, Mr. President. Thanks for your hospitality. You know, for the benefit of the group, I want to take you for a couple of minutes to an experience that I had with then State Senator Obama in the state of Illinois when he took on a very controversial initiative regarding the death penalty situation. Unless you think that death penalty is sort of a junior varsity issue, it's not. It's crimes, it's claims of innocence, it's penalties forever. And then State Senator Obama approached Republicans and said, look, let's fix this. Let's recognize the problem here. Let's fix it. But it was very different than what I sense is happening today. What I sense is happening today is what is it going to take for you Republicans to vote for our bill? That's the subtext that I'm getting. My sense is that this is a problem of message. It's not a problem with the messenger. We've got an incredibly skilled messenger who has been out these past several months in joint session speeches and a whole host of other venues, interviews, talking. You've all seen it, you've all participated, you've all listened. And I think the American people, when the conversation first began about expanding coverage, lowering costs, were actually hopeful. And it wasn't just a bumper sticker. I think they were actually hopeful about what was going to be happening. And they listened, and they listened, and they listened. And my sense, now I can't speak for every one of your districts, but in my district, they've become increasingly disappointed with what they have seen come out of this process. And this is not a prop. This is the Senate bill. And my district says, you know what? That's sure looking like just something that's now being popped in the microwave, taken out, a little salt, a little pepper, some Republican breadcrumbs on the top, and put it back in front of the public to say, well, do you like it now? And my district really doesn't. I don't know. I suppose you represent some districts that do. And I think one of the problems to get to this coverage issue is that the premise of this bill is that coverage is expanded through Medicaid, welfare. Speaker Pelosi a couple of minutes ago, or a couple of hours ago, actually said that health care reform is entitlement reform.
No. Yes.
Yeah. I would put a brighter light on that and say it's entitlement expansion. Think about what we're doing. You know, the CBO, when they wrote to wrote to Senator Reid a couple of months ago, they said, look, there's about 15 million people that are going to be put on Medicaid. And Medicaid is a house of cards. Medicaid is not something that is serving the public very well. Their state controller in Illinois, and we all come from states with real trauma. State controller in Illinois recently wrote that as bond rating agencies continue to downgrade Illinois rankings to the lowest in the nation, the state can't afford further jeopardizing. This bill, Section 2001 of the Senate bill, takes away all the flexibility as it relates to changes in Medicaid. That is making our states, I think, ultimately hidebound in how they approach these things. This is something that, in my view, isn't sustainable. Governor Brian Schweitzer of Montana said, let me give you a quick quote, "One of the least effective programs in terms of health care in the history of the country is called Medicaid. About 20% of America is on a Medicaid program, and they'd like to shift, they, meaning Washington, would like to shift it and grow it to somewhere around 25 or 30%. Now, Medicaid is a system that isn't working. Almost everyone agrees. But what Congress intends to do is to increase the number of people on Medicaid so that they can do it on the cheap. It isn't working for anybody." Look, the foundation of the expansion is Medicaid. And in my view, and I think the view of folks in my district, and I think many, many people across America, it is a flawed foundation. And we can do much, much better. A Republican proposal that's out there would reduce the number of uninsured by 3 million people. So, look, you've heard it today in many, many forums. Remember the old, in closing, you remember the old game you used to play as a kid, Etch-a-Sketch? And you'd start out with the Etch-a-Sketch, that little thing where you'd try and draw something and you dial the dials, and over a period of time, the more you dialed, the more crazy it looked, and then finally you'd say, oh, let's just go like that and do the Etch-a-Sketch. I'll tell you what, a year's worth of work, and this is what has come up with, the American public, as far as the ones that I have heard from, are vehemently opposed to this. And they say, look, take the Etch-a-Sketch, go like this, let's start over, let's do incremental things where there's common ground. I yield back.
I want to make sure that everybody gets an opportunity to speak, but I just want to caution everybody, it's now 4:15. There are a number of folks who haven't had a chance to speak. You know, the question I had was, were there ideas about expansion beyond the 3 million that was in Leader Bonnier's bill, and I didn't get an answer on it. So in addition to, and it may be that the answer is that's all we can do. I should point out this one issue about Medicaid that I think that's important. Most of the people we'd like to be in the exchange and giving them subsidies. And I think over time, you see as an evolution, if you created a large enough pool where people could purchase it through an exchange, the same way that members of Congress do. The problem we've got right now is that very poor people, they've got coverage through Medicaid. And it's somewhat flawed. There are problems with doctor reimbursements. There are problems long-term in terms of solvency, both for the state and the federal level, so all those things need to be fixed. But the fact of the matter is, if their kid gets sick, they can go to a doctor. The people who are really left in the cold are working families who make too much for Medicaid and don't have anywhere to go. That's the group that right now is getting the worst deal. They're paying taxes, they're working, but they've got nowhere to go. Now, for those 15 million people who've got nothing, I promise you, they would say to themselves, having some coverage through Medicaid is a pretty good deal. I'd prefer to have them in an exchange where over time we've got everybody in a pool, similar to the pool that members of Congress enjoy. But that's not the situation that we have right now. I just want to remind everybody, though, that the group that is being left out, because you threw out the word welfare, which is, you know, one that obviously most American people, they don't want to be part of welfare. The fact of the matter is that very poor people right now have coverage that is superior to what a lot of folks who make a little more money, are working very hard, trying to support their families, do not. Now, I know that Max has been trying to get in for a while, but there are some other folks that haven't had a chance to speak, so I want to call on them first. And then if I've got time, Max, I'll allow you to wrap up. But I'm going to go to I've got Chris and Murray, Chris and Patty Murray on our side, as well as Charlie Rangel, who want to speak. And what we'll do is we'll alternate to make sure that we've got. Oh, and I know that Joe Barton is interested in speaking as well, and there may be a couple other Republicans.
I followed you.
Okay, go ahead.
Oh, thank you, Mr. President. I'll try and keep this brief and turn it over to Patty, so we'll take. the time for one person and divide it between two. Let me first of all thank you as well, and thank all of our colleagues who've done this. It's been tremendously helpful, I think, today. And it's been said earlier, maybe it needs to be focused as well. I like many of you, like all of you here, in my state, there are 31 hospitals, and they're terrific people. Whether or not the quality of care is equal for everyone in this country is certainly questionable, but certainly the quality of the people who are our health care providers, the nurses, the doctors, and others, do an incredible job every single day. And in a sense, I was struck when Congress was talking about the death penalty issue that was debated some time ago in Illinois. I think most of us around this table here would agree today that every person, if they're confronted with a legal problem, has a right to a lawyer. That's something we've accepted as a country. It's somewhat ironic, I suppose, and history may judge us accordingly, that while everyone is entitled to a lawyer, regardless of what you've been charged with, that you don't have a right to a doctor. And yet, at the same time, we acknowledge that we provide care. If you show up in an emergency room, we take care of you. And that's a great testimony about who we are as a people. The problem is, of course, that the cost associated with that. I think there's a false assumption that that's one group of people and they're out there and they have no impact on what happens to those who have insurance today, and somehow they should be taking better care of themselves, they should quit smoking, they should eat better, they should get a job, that somehow the responsibility rests with them. If you even accept that, which I don't, the fact of the matter is that sector of our population affects everyone else. It costs us about $248 billion a year in lost productivity when you have increased numbers of uninsured people in the country. At this very hour, there's a cost with every single insured person in this country of roughly $1,100 a year. To pay for that cost of that person showing up in that emergency room or getting that care, that's a hidden tax that Americans are paying today when people show up for that kind of support. There are, today before this, we wrap up and go back to our offices and go back to our homes this evening here in the District of Columbia. 14,000 of our fellow citizens will have lost their health care today. And every day that we're here debating and discussing this, 14,000 Americans lose their health care. Roughly 6 to 8 people will have lost their lives today as we gather around this table because they're uninsured, based on a Harvard study and National Science Foundation study, that we lose that many people on a daily basis because they lack health insurance. So there are tremendous costs associated with this. Henry said it well, Tom said it well, and Mr. President, you certainly encapsulated it very well. These are not segmented issues. And while incremental approaches are something I generally support and approach after 30 years here in dealing with major issues, but this issue defies incremental approach. You can't get from one point to the next incrementally unless you deal with it holistically. And that's really what we're trying to do. Now, you may disagree about whether or not we're doing too much in mandates or too much here and there, and that's a legitimate debate. But you can't get to affordability, you can't get to quality, you can't deal with the major economic issues if you don't deal with coverage. You just can't. There's no way to do it. You've got to have broadening coverage if you're going to have any effort or any successful effort in reaching those questions. Lastly, I just say this to you. A guy in my state, Kevin Galvin. Kevin he employs 7 people, a maintenance operation in Hartford, Connecticut. He wanted to provide health care. And like the stories you've all heard, he lost a fellow of 24 years because the guy had a health care issue. He finally had to take less pay, took another job because there was health care provided. But Kevin did more than just tell me a story about himself, Mr. President, what happened to his 7 employees because he couldn't get health care. He went out in my state of Connecticut and organized 19,000 small businesses. And they changed the law in Connecticut regarding pooling in small businesses. Because here was a small business guy who wanted to take care of his people and watched tragically day after day what happened to individuals because he could not provide it for them any longer. And I think people like Kevin Galvin exist in every district, in every state, who want to provide that health care, understand how valuable it is to them, their productivity, and of course the importance of their employees. But coverage is the critical issue. We know that in the next 10 years, factually, Mr. President, in the next 10 years, every state in this country will have a 10% increase in uninsured people. We know that in 30 states in our country in that same 10-year period, there'll be a 30% increase in the uninsured. And half the population under the age of 65 will at one point or another in the next 10 years be without insurance. So it's not some isolated group out there. This is the critical constituency that is the sort of the linchpin that holds all of this together. So coverage is absolutely critical.
Thank you, Mr. President. I want to commend you for asking us to come here, and I will say that never have so many members of the House and Senate behaved so well for so long before so many television cameras. So if we ever get to a conference committee, we may want you to be the moderator. I do think, though, that there is a fundamental difference in the vision that you and your friends on the majority have put forward and the vision that myself and those of us in the minority have put forward. It's the fundamental role of government. We believe that we should use free markets to empower people and give them choices. And for the best of intentions, yourself and most of your allies in the Democratic Party seem to believe that the government, either through a mandate or through a regulatory requirement, knows better and will do better for health care for most Americans. Now, whether you have a mandate or simply give the Secretary of Health and Human Services the ability by regulation to require something, that's a difference that's a distinction without much of a difference. So the 6 common sense ideas that various Republicans have put out here is not incrementalism in the sense that it doesn't go together, but it does not radically change the basic health care system of America. If you give the ability to sell insurance across state lines and prevent a state from precluding it, if the insurance company can prove that it's solvent and that it will pay the benefit, health care costs will go down in that state and premiums will go down. There's a study just out that in the state of California, health care premiums would go down 50% if Californians could buy insurance from Nevada or Oregon. If you create a catastrophic high-risk pool and put the cap on it that Leader Boehner did on his alternative on the House floor and allow small businesses to create the kind of pools that we've talked about, you're going to be able to give those Americans who can't get insurance because of a pre-existing condition and want it the ability to get into those things, and their premiums will not go up catastrophically. They will not go up astronomically. And one of the things that we seem to have agreement on, according to yourself and Senator Durbin, is medical malpractice. Now, your proposal and the House bill and the Senate bill pay lip service to medical malpractice, but they don't really do it. Again, if you take the Boehner proposal that was put together and put up on the House floor, and it's based on what's happened in Texas, which put in medical malpractice reform in 2003, premiums for medical malpractice have gone down 27%. Texas has gained 18,000 doctors since this reform was put in. There are 55 rural counties in Texas that now have an obstetrician. If that is extrapolated nationally, you're not going to save the $54 billion that Senator Durbin alluded to and that yourself alluded to if you combine the direct savings with the indirect savings because the price of practicing defensive medicine goes down. You probably save $150 billion a year. Now, that's real money. So what we're saying, Mr. President, we're not talking about incrementalism. We're talking about, as Leader Boehner said, and Senator McConnell said, let's start over in the sense that we change the vision and work together to do the things that we agree upon, but do it in a way that doesn't destroy the fundamental market system that's made the American healthcare system the best in the world. And if we do that, we can make a deal.
Well,
thank you, Mr. President. Thank you, Leader Boehner.
Joe, I'll respond to you right at the end because I think we should wrap it up. You're right. The proposal that John Boehner's put forward doesn't radically change the existing system. And that, I think, is why 3 million out of the 30 million who don't have coverage, or 40 million, don't get coverage. The proposal that's been put forward by the House and the Senate Democrats also doesn't radically change it in the sense that the vast majority of people who currently have health care will still get it. It's just they'll see it a little cheaper. People who do not have coverage will start getting it. So it's not neither of these proposals are radical. The question is which one works best for the American people, and that's what we'll see if we can determine. We're running short on time. I know that some folks are going to, at some point, have to get going. I'm going to reserve the prerogative of making sure that everybody who has not had a chance to speak is allowed to speak, and then I will wrap up. That means that we're probably going to go a little bit later than we had anticipated, but as I said, by the standards of Washington, we're still in the ballpark here. I'm going to call on Charlie Rangel first. We'll go to one of our Republican colleagues. Patty Murray's going to have an opportunity to speak. Again, there may be some comments. There may be some other Republicans who are interested in speaking. We'll go to. We're going to actually go to Ron Wyden first. Then we're going to go to another Republican, and we're going to end with John Dingell, who was there when the idea of everybody having health care was first introduced by his father many decades ago.
Mr. President, why don't you just call on Republicans who haven't talked, because some of them have talked numerous times.
I agree, but I want to make sure that they may want to respond to whatever is said. Go ahead, Ron.
Thank you very much, Mr. President, and I think this has been a very constructive session. For the last 6 hours, we have essentially heard Republicans talk about incremental coverage and Democrats talk about comprehensive or broader kind of coverage. And I want to outline something that I think could bring both sides together for just a couple of minutes. First, on the incremental point, the evidence shows that incremental reform not only does less, it costs more. And the experts that both Democrats and Republicans rely on have found this. The Lewin Group, for example, that Republicans quote from, they say that, and both sides use them. Also, history. We have been doing incremental reform in this country since 1994. Since the blow-up of the Clinton plan, that's exactly what we've been doing. And costs have been gobbling up everything in sight, in the private sector and in the government. So I would submit that instead of this debate about incremental reform, comprehensive reform, we could all be for real reform. And real reform, in effect, changes the incentives that drive the system, and particularly empower the consumer. And Mr. President, I've been very pleased that you've constantly been coming back to the system for members of Congress. Folks, all of us can fire our insurance company, every one of us. And as far as I'm concerned, we've got to stay in this battle until everybody in the United States has that right to hold the insurance companies accountable and to fire them. And one of the promising points you made this afternoon, Mr. President, that I appreciate is the point on interstate shopping, because this is another opportunity, in my view, done properly to empower the consumer. Now, colleagues, our system, the one that we enjoy, already allows interstate competition for health insurance. That's the way the federal system works right now. And there are good consumer protections. So, Mr. President, when you made that offer to all of us today to work with us on this, not only am I going to follow up on what I think is a very gracious offer to try to bring both sides together, it allows us to build on the exchanges that we have today, which begin to empower people with more choices and competition. And if we just keep building on that, starting with this effort to bring both sides together on interstate competition, looking, in my view, at the federal employee system to do it, I think we can resolve a lot of our differences. So I appreciate the opportunity to speak, Mr. President. I want colleagues to know that I'm going to be following up with both sides of the aisle this afternoon in your administration to bring this group together.
Mr. President.
Yeah.
All of my members have had a chance to speak at least once, several of them a number of times. John Kyle reminds me that HSAs, for example, are not exactly for rich people, that the median income of a user of a HSA is $69,000 a year. All of us are representatives of the American people, but I have a feeling we haven't been listening to them very carefully. Congressman Roscom mentioned what the people in his district think, and I expect all of you are experts on what the people in your districts think. But we know from the polling that's been done in this country how the American people feel about this 2,700-page bill. We know how they feel about it. This is not a close call. If you average all of the polls in America, we know that the American people oppose this proposal on an average of 55 to 37%. They have also been asked, and we keep reading in the newspaper that where we're headed next is to the reconciliation approach. Gallup also asked that question. They explained to the American people what it meant so they understood what this word that we use around Washington actually means. And in the Gallup poll, American people were opposed using that 52 to 39. So this has been a fabulous discussion, Mr. President. We have a lot of experts around the room, but I think it's really important, since we represent the American people, that we not ignore their view on this. They have paid attention to this issue like no other issue since I have been in the United States Senate. Health care is a uniquely personal issue. Obviously, you get more interested in the subject the older you get, but every American cares deeply about the quality of their health care and access to health care and cost of health care. They have followed this debate like no other, and they have rendered a judgment about what we have attempted to do so far. The solution to that is to put that on the shelf and to start over with a blank piece of paper and go step by step to see what we can agree on to improve the American healthcare system, which is already, as all of us agree, the finest in the world.
I'm just going to make this remark, and then I'm going to call on Patty Murray. I'm going to save the two lions of the House here for the end. Because there's been a lot of comments from every Republican about the polls and what they're hearing from their constituents. And as I said, I hear from constituents in every one of your districts, in every one of your states. And what's interesting is actually when you poll people about the individual elements in each of these bills, they're all for them. So you ask them, do you want to prohibit pre-existing conditions? Yes, I'm for that. Do you want to make sure that everybody can get basic coverage that's affordable? Yes, I'm for that. Do you want to make sure that insurance companies can't take advantage of you and that you've got the ability, as Ron said, to fire an insurance company that's not doing a good job and hire one that is, but also that you've got some basic consumer protections? Yes, we like that. Polls, I think, are important in taking a temperature of the public. If you polled people and asked them, is the system working right now, and should we move forward with health reform, they'd also say yes to that. And my hope had been, and continues to be, that based on this conversation, there might be enough areas of overlap that we could realistically think about moving forward without a situation in which everybody just goes to their respective corners and this ends up being a political fight, because this is something that really has to be solved. We've got 3 people who have not had an opportunity to speak today. If you don't mind, I would like to, in the interest of time, just go ahead and let each of them speak. If there's an intervention that somebody on the Republican side wants to make, then I will recognize them. And then I will allow anybody of your choice, Mitch, to wrap things up. I think Speaker Pelosi may want to say just a quick summary of what she's thinking, and then I will talk a little bit about next steps. And if everybody could keep their remarks relatively brief, that'd be very helpful. Patty.
Mr. President, thank you. And this has been, I think, a very good discussion. And I think all of us come to this table today having heard a lot of stories and talked to a lot of people and bring their passions with us today, and I certainly am one of those. And every time we talk about this, every time I think about this, I remember a little boy that I met last spring who was 11 years old, whose name was Marcellus, and he told me that his mom, single mom, taking care of him and his two younger sisters, was going to work every day, had a job managing a fast food restaurant, was doing okay, but she got sick. And when she got sick, she had to take time off from work, and because she was missing so much work, she lost her job. When she lost her job, she lost her health care, and because she lost her health care, she couldn't get in to see a doctor, and sadly, Marcella's mom died. I think about him every time we talk about this bill. And what happened to her is happening to so many Americans who, when they get sick today, don't have any choices. They have nowhere to go. Either they don't have insurance, or they've been denied insurance because they have a pre-existing condition, or they're a small business whose premiums have gone up so dramatically that they can no longer afford to provide it for their employees. Too many Americans today are in a box and they don't have a choice. Frankly, it's why so many Americans today are passionate about a public option. It was a choice for them that they felt was important to them. But in the bill that you have presented and that we've been working on, that is so important is it finally gets some people out of that box of no choices. By giving them an exchange that they can go to, by taking care of the insurance reforms so they're not denied coverage, by opening up community health centers so people have choices, by making sure that we lower the cost for all Americans, because when we provide coverage for 30 million Americans, it lowers the cost of everyone who has insurance today by $1,000 a year a family. This is why this is so important, and what I have listened for today is whether the alternative proposal that has come before us gives people those choices that they need. And that's what I'm listening for, and I go back to Marcellus and I think, will that proposal make sure that nobody loses their mom again because they didn't have a choice? And that's why it's so important that we move forward with what we have and open that door for so many Americans.
Thank you. Mitch,
Mr. President, Dr. Coburn.
Tom.
I just was going to summarize shortly because we were talking about if we don't think about what the key goal is, the key goal is to reconnect purchase and payment so we become good purchasers. Whether we create what system we do, if we don't reconnect the mechanism of payment with purchase, we're not going to get good value out of our healthcare system. And I outlined 1 out of every $3 that doesn't help anybody get well, doesn't prevent them from getting sick. And there's enough potential there in that pool of money that we don't have to have the government run it. What in fact we can do is we can create and allow that money for everybody to have the kind of access that Senator Murray wants that individual to have. The thing that I think draws us apart is the level of involvement in the government in making those choices. And I would just put forward to you that we ought to have another talk like this as we can get closer and closer on some ideas, because we all want the same thing, but how we get there, whether or not we're in charge of it or the individual patient's in charge of it, personally making their own choices with the asset value that is capable based on what we're already spending in healthcare. We don't need to spend a penny more in healthcare in this country. What we need to do is spend it much more wisely and much more effectively.
Okay. I'll pick up on some themes in my close. Charlie Rangel.
Thank you, Mr. President, and I appreciate the fact that you saved the best for last.
Absolutely.
I had really hoped that when we came here that we were really going to push over the top. We are so close to national health insurance. We are so close to allowing people that go to work every day and don't know what could happen to them when they lose their job and lose their health insurance. I know that they call the Senate the upper house, but I was amazed how it seems as though they believe the American people only listen to those from Wyoming and Kentucky. But having said that, for my New Yorkers, even though we have more self-confidence that we need, I would want them to know that they are Americans, and we do listen to them, and that the states that oppose this great plan doesn't speak for all of America. Having said that, some people have called those who oppose us as being the party of no. I don't think so, notwithstanding the fact we got 5 Republicans from the Ways and Means Committee here at your summit. Now, when we spent hundreds of hours in 3 committees and Ways and Means, and there wasn't one bill before us. And I would think that instead of taking the president's time, that this is where the House and the Senate would take care of legislative business, especially if we agree on 70%. For God's sake, then for the 10 or 20%, why do you say scrap what we got unless it ends up with that you have made up your mind that we're not going to have a health bill? And then I would say that most all of America would find it not more difficult to understand why the bill is so big or why we're using reconciliation. I think one of the big problems America would have is, why does it take 60 to get a majority? And I have to explain, well, that's the Senate, and they're different than most Americans in understanding it. So what I would hope would happen is that we leave here not thinking that we're going to start all over. We can't get back those times. This is the last year for a whole lot of people in the House of Representatives who we believe we represent the people too. Why can't we take what we've agreed to? I mean, sick people, scared people are not Republican and Democrats, they're Americans. And you've made it abundantly clear that you have the same sensitivity, you recognize the fiscal crisis, you know what can happen to our country if we're not educated, if we're not strong in a healthy way. Have staff or somebody bring together those issues that cannot be contradicted in terms of what you want. And I know you want more than just 3 million people insured. You can explain why it's difficult for you to do it. But I know you would want to achieve having most all Americans, or all Americans, with the same health benefits, because that's so important. And then, Mr. President, after we start learning to agree with each other, and it's not a question of no, but it's the Congress working its will for the good of people, then we can work out, and God knows Mr. Kemp and I have tried desperately hard, and Jim McCreary before him, to realize people aren't concerned with the debate. They're concerned with what are we going to produce. And I don't care what your color is, I don't care what your party is, that if you're sick, and you don't check out the doctor. And they're not going to check out whether or not you're Republican or Democrat. So I just hope that we can change this to a positive thing where you can say, let's leave here at least talking about what we agree on. Let's stop knocking each other as who's the smartest and who's the most patriotic. And let's really then confine the public argument to where we disagree. And rest assured, I can assure you that they won't be concerned with how big the bill was. I have no clue as to how big the Social Security bill was, how large, how many pages was in the Medicare bill. And I don't really think that someone sick in the emergency room is concerned about the size of the bill that we are trying to help them with. So I appreciate this. And
John Dingell.
Mr. President, thank you. And God bless you for your leadership in this matter. The country desperately needs you and desperately needs this legislation. I saw a cartoon. 2 people are sitting down, and one of them says, terrible news. Our health care rates are going to go up 40%. The other guy says, don't worry. Good news is you're not concerned because you have pre-existing conditions. This solves both problems, the bill. And Mr. President, again, we desperately need your lead. Now, having said that, when my dad started out on this years ago, Harry Truman said, you know the reason people don't have health care in this country? They can't afford it. And he was right. And it's still the case today. I saw this morning a statement that was made with regard to starting over. This comes from a respected Republican leader, Governor Schwarzenegger, California, February 23rd, 2010. I think any Republican that says you should start from scratch, I think that's bogus talk and that's partisan talk. I think we need to buckle down and get to the business of solving the biggest problem that this country has coming down the road at us. In 2025, the cost of a family's health insurance is going to double, $25,000. I don't know anybody can afford that. You can argue about Cadillac plans and other nonsense. That's not going to be important. And in 2080, the cost of all of our health care is going to equal the gross domestic product. That's a recipe for disaster. We have much in common, I want you to know, and I hope and pray you will take a look. We cover young adults under their parents' insurance. That's a Republican offer. We prohibit dropping insurance coverage when the patient gets sick, but we don't. And the Republicans do too, but they don't cover pre-existing conditions. Both of us prohibit annual and lifetime limits. High-risk pools we have and they have. But high-risk pools carry with them some risk because it constitutes an incentive for a race to the bottom, whereby people will move their insurance companies to a place where they have the least regulation and the least protection for the consumers. And it also includes, and amongst the other 14 items where we're agreed on, is the availability of health savings accounts. There are a lot of other things here that we have and we need. I would say that I've seen some of my friends who I knew before they were virgins. They were pushing, for example, use of the extraordinary budgetary mechanism, and as to get this decided by 51 votes. Seems like a great idea. And I'm curious, why in the name of common sense are we being so fussy about having the decisions in the people's House and the people's Senate decided on the basis of a simple majority, 51 votes? And if there's something wrong with that, I wish somebody would tell me why we ought not give the people that kind of representation. I would note that also mandatory coverage mandates. That was in a bill introduced by my good friend Bill Thomas, Chairman of Ways and Means Committee, and 20 members of the U.S. Senate. They said, and they were not fussy about that. And I think we ought to look to see, here we have a chance to serve the people. I have people coming to my office with tears in their eyes. They can't get coverage. They have pre-existing conditions. A young dental surgeon I knew couldn't get health care. Why? Because she'd had breast cancer years before. She couldn't get care. And I've seen a lot of other cases like that. People who would have drive-through pregnancies or drive-through mastectomies and all manner of high-handed abuse by the insurance companies. I'm always surprised when I can find somebody that's defending the insurance companies after the things that they do to the ordinary people in this country. They could cancel your insurance policy while you're on the gurney headed into the operating room. If somebody would explain that to me, I would be deeply grateful. But the fact of the matter is, we have a chance to do something that Dan Webster one time observed. I thought it was a very useful thing that he said, and I think we ought to say it. He said, "Let us see whether we also, in our day and generation, may not perform something worthy to be remembered." It's on, Madam Speaker, as you well know. It's on the wall of the House of Representatives. It's there for us in the House, and my colleagues in the Senate will know it. Those of you who I see again and have served with us will recognize that as something. We have before us a hideous challenge. The last perfect legislation that was presented to mankind was delivered to the Israelis at the base of Mount Sinai. It was on stone tablets written in the fingers of God. Nothing like that has been presented to mankind since. What we're going to do is not perfect, but it's sure going to make it better, and it's going to ease a huge amount of pain and suffering at a cost which we can afford, which has been costed out by the Office of Management and Budget and the Congressional Budget Office, saying it's budget neutral. It in fact reduces the budget. I beg you, my friends, let us go forward on this great task.
Thank you, John.
Thank you, Mr. President.
Speaker Pelosi wants to say a brief word. John, do you want to say anything in closing? And then I will wrap up. Nancy.
Thank you very much, Mr. President. As one who has abided by the 3.5 minutes, I'm going to take a few seconds more now in closing to extend thanks to Mr. President for bringing us together, for your great leadership, and without it, we would not be so very close to affordability, accountability for the insurance companies, and accessibility for so many more Americans to improve their health care, to lower their cost. Mr. President, I hearken back to that meeting a year ago. At that time, Senator Grassley questioned you about the public option, and you said the public option is one way to keep the insurance companies honest and to increase competition. If you have a better way, put it on the table. Well, I bring that up because we have come such a long way. We're talking about how close we are on this, how far apart we are here. But as a representative of the House of Representatives, I want you to know that we were there that day in support of a public option which would save $120 billion, keep the insurance companies honest, and increase competition. We've come a long way to agreeing to a Republican idea, the exchanges. Senator Enzi has been a leader in that. Senator Snowe, along with Senator Durbin, had legislation to that effect, a bipartisan, because the insurance companies opposed the public option. They couldn't take the competition. We have in our bill market-oriented, encouraging to the private sector initiatives. I think the insurance industry, left to its own devices, has behaved shamefully, and we must act on behalf of the American people. We have lived on their playing field all this time. It's time for the insurance companies to exist on the playing field of the American people. I believe I have news for some of my colleagues, because we have very much more in common. Senator Coburn, you had so many positive suggestions, which I didn't hear much else of, but from you we did. And I think you'd be pleased to know that after much debate in our House, we came up with value, not volume. Others have called it quality, not quantity, in terms of utilization, overutilization. Senator McCain, when you talk about Florida, we're talking about addressing the regional disparities in terms of compensation and health care. So we have addressed many of these issues in the bill. I think it's really important to note, though, and I want the record to show, because two statements were made here that are not factual in relationship to these bills. My colleague, Mr. Leader Boehner, the law of the land is there is no public funding of abortion, and there is no public funding of abortion in these bills, and I don't want our listeners or viewers to get the wrong impression from what you said. Mr. Camp, you said that the Medicare cuts in this bill cut benefits for seniors. They do not. They do not. So I want the record to show, just in those two cases, where we may have differences of opinion and of approach and evaluation of the value of different things, but certain things are facts about our bills that I cannot let the opposite view stand when they are stated. Yes, it's hard to do this. Misrepresentation campaign that is going on about these bills, it's a wonder anybody would support them, as Mr. Waxman said. But the fact is, as the President said, many of these provisions on their own are largely supported by the American people. So this will take courage to do. Social Security was hard. Medicare was hard. Health care reform for all Americans, insurance reform is hard. But we will get it done. And as we leave this debate, I think that many of the differences that we have are complicated, and they're legitimate. They're differences of opinion about the role of government and the rest. But I think it's really clear on one point that the American people understand very clearly. They understand that there should be an end to discrimination on the basis of pre-existing conditions. The proposals that we have put forth end discrimination on the basis of pre-existing conditions. The Republican